I'm Dr. Saman Hettige. I'm an Ayurvedic psychiatrist.
Okay, what is Ayurvedic psychiatry?
Yeah, actually, this is endemic to system of our own, and this is a tradition of our own. I belong to the 7 generations of Ayurvedic psychiatries, and this is coming from our generation, and it is still preserved, and we are practicing, which they have been practicing 500, 600 years old, and in our medicine, we are talking of a permanent cure, not suppressing the symptoms. And by giving the medicines, we are expecting a permanent cure in most of the psychiatric conditions.
Okay. What are the most important psychiatric conditions you cure?
Almost everything, almost all psychiatric conditions, from minor to major.
More of diseases or more of the patient coming for what?
Like depression, schizophrenia, bipolar, manic. I think 60 to 50% are manic patients. In Sri Lanka, especially the young adults between 15 to 13. For example, if you take Sri Lankan population, so they have calculated and estimated 12% of the total populations, they have been psychiatric patients. So out of 12%, 2% are suffering from major mental illnesses, and 10% from the population, they are suffering from major illnesses like obsessive compulsive diseases, sexual deviation, that type of conditions.
What do you think is the cause of this? It's a high number, right?
Yeah, actually, we can't pinpoint one exact cause, but if you take the causes for psychiatric condition, those are called multifactorial. There are many causes. So environmental changes, the fungicides and pesticide use, and the war which we have been experienced nearly 20 years, that has been affected a lot for psychological conditions of the people. Especially they have estimated the north and east, those who have been affected by the war, the 60% have got a mental illness, either minor or major.
And what kind of medicines you are using?
We are totally depending on Ayurvedic medicine, and as I told you, this is a traditional system of our own. We are mixing Ayurveda and traditional system of our own. We are using decoctions, head packs, the nasal draining nasne, what we call, and purgatives, oil applications, and all the traditional systems are being used.
And you are talking about 100% cure?
Yeah, we are talking about 100% cure.
But is this method taught somewhere? You teach them or something like that?
Yeah, actually, our system has been introduced to the indigenous faculty of Sri Lanka, and it is being taught there for the 5 years graduates. It is being taught under the guidance of the indigenous medical faculty. And apart from that, we are not teaching in our institute.
Okay. Thank you very much.
My father is also still practicing now. He is 85 years.
Very good.
Yeah.
May I have your permission to upload this on internet?
Yeah, sure.
Okay. Thank you very much. Give my regards to your father.